The topic we are going to discuss today is difficulty swallowing. It feels like trouble swallowing liquids, solids, or both, regurgitation, pain with eating or drinking. Bulk eating or drinking can make it worse. Bringing swallowed food back up into the mouth, regurgitating, or taking nitroglycerin can make it better. On your patient visit, you will ask him about chest pain, neck pain, throat pain, regurgitation, neck swelling, wheezing, hoarseness, cough, heartburn, difficulty chewing foods, weight loss, anxiety, depression, drooling in child. You will also want to know if he has ever had a chest X-ray, an examination in which patients swallow barium, or an exam in which a doctor put a camera down patient's throat to look at his stomach's lining. You will want to know exactly where the food sticks in his mouth, if he has ever swallowed chemicals, or if he has ever had a tube stuck down his nose to reach his stomach for feeding or an examination. You will want to know if he or anyone in his family has had any of these conditions: Raynaud's phenomenon, ulcers, hiatus hernia, neurologic disease, recent or recurrent pneumonia. You will want to know if he's taking any medications. You will do a physical examination including the following: weight, checking the throat for signs of inflammation or swelling, checking his gag reflex, thorough neck exam. If a patient comes to you with symptoms like throat discomfort, coughing due to swallowing air, he might be suffering from muscle disease, which causes problems in the muscles of mouth and throat. It may also be due to neurologic disease, which is a disease of the nervous system that affects mouth and throat functioning and usually exhibits same symptoms. If a patient comes to you with symptoms like severe sore throat, swallowing may be painful, drooling in child, he might be suffering from an inflammation, like inflammation in throat structures, including the tonsils, may involve infections such as strep or pharyngitis. If a patient comes to you with symptoms like no difficulty swallowing, sensation of a lump in the throat, it might be due to globus hystericus, which is a mental disorder in which you feel as if you are choking. If a patient comes to you with symptoms like regurgitation after eating or drinking, trouble swallowing, pain may disappear after regurgitation. He might be suffering from achalasia, which is a condition in which the tube that leads from the throat to the stomach is unable to relax. If a patient comes to you with symptoms like regurgitation after eating or drinking, chest pain with eating, pain relieved by nitroglycerin, he might be suffering from diffuse spasm, which is spasm in the muscles of the tube leading from the throat to stomach. If a patient comes to you with symptoms like more trouble swallowing food than liquids, nighttime regurgitation, recurrent lung infections, history of heartburn, maybe history of swallowing corrosive material, it might be due to stricture, which is narrowing of the tube leading from the throat to the stomach. If a patient comes to you with symptoms like more trouble swallowing food than liquids, nighttime regurgitation, recurrent lung infections, heartburn, history of Raynaud's phenomenon, blood vessel spasms that affect the flow of blood through the body, predominantly affecting women and resulting in cold extremities. It might be due to scleroderma, which is a disease of the connective tissue. If a patient comes to you with symptoms like more trouble swallowing food than liquids, nighttime regurgitation, recurrent lung infections, foul breath, regurgitation of food many hours after meal and chest pain, he might be suffering from diverticula, which is small pouches that extend from the wall of the tube leading from the throat to the stomach. If a patient comes to you with symptoms like throat discomfort, coughing due to swallowing air, chest pain, symptoms worsen over time, eventually regurgitation of saliva, he might be suffering from cancer, which is unchecked, abnormal growth of cells into tumors in the mouth or throat. So that was all for today. Keep following sqadia.com for more such videos.